Hi, my name is Agustin, and today we'll be talking about bipolar disease in the public health. So let's dive right into it. Why am I interested? So personally, I do have friends that do suffer from bipolar disorder, and I'm intrigued by how they manage the disorder and how they handle their episodes, even knowing if they arrive or not, right? So what is bipolar disorder? So let's dive into it. People with bipolar disorder have episodes of what you call mood swings, right? Which is a mental condition marked by alternating periods of elation and depression, meaning it could be high energy out of nowhere to low energy out of nowhere, resulting in depressive episodes, loss of touch with reality, or even reduced sleep. That's how much it affects you at an everyday basis, right? But there are three types of bipolar disorder, with bipolar 1 being the most severe symptoms with the extreme elevation in mood and energy. You get these manic episodes of your emotions, and it's not fun. But bipolar 2, although less severe and shorter in episodes, you still do get the elevated mood swings, right? And cyclothymic, the least major and the least severe of all three, you still do get those emotional ups and downs with the mild symptoms, of course. So why is this topic important? Well, first off, it's chronic, right? It can be given from mother, father, and it can also last for years and be lifelong for a person. You might have this disorder until you die, right? Luckily, we do have ways to treat this chronic disorder. Although not cured, you can treat it with medications and a bunch of therapies, right? And we're also going to be talking about lifestyle, right? The importance of this topic is because it affects people in their everyday lives with the high energy, the mood upswings, and then the mood downswings. It's a huge, important topic to be talking about in public health, right? And bipolar disorder not only affects young adults or even adults in general, but children and adolescents. It's a major talking point for public health and needs to be addressed. So, going over the table of contents, we'll be talking about the epidemiology of bipolar disorder, and then we're going to talk about how it integrates into public health and the importance of it and the issue of bipolar disorder, and also prevention strategies for bipolar disorders and the treatments of it. So, let's dive into the epidemiology. First off, let's ask the question, what is epidemiology, right? The method is used to find the causes of health outcomes and diseases in populations, which is super important in public health. This is how they analyze their data and find out the causes of bipolar disorder, right? So let's get into it. With 1 being genetics, 2 age, and 3 location. Genetics being, I already talked about this before, it can be given to you, not only from your parents, but also if you have creative traits that are high functioning, you may be in genetic risk of bipolar disorder, correct? And also the age, right? We find that around 15 to 24 years old, around that peak, is when you find the most bipolar disorders throughout that age, according to the National Institute of Mental Health. And also location, right? Because it was found that the type 1, bipolar disorder type 1 in the USA was higher than other countries by 1%. So the prevalence of bipolar disorder, given the data given from National Institute of Mental Health during 2001 and 2003, 2% of US adults had bipolar disorder, which is absurd, right? When you think about 2.8% of the United States, it's actually a huge margin. And among those adults were, although same female and male, the 4.4% of adults in the US have already experienced bipolar disorder at some time throughout their lives. 4.4% doesn't sound much, but once you account the whole United States population, it is a drastic number. And mind you, this is from 2003, so the numbers might have drastically risen, right? And also from this graph, also from the same National Institute of Mental Health, we can see that an estimated 83% of people with bipolar disorder have a serious impairment, which is a huge deal because the other 17% have a moderate impairment, meaning that there's with bipolar disorder comes with a serious or moderate impairment, right? Analyzing this data from also National Institute of Mental Health, we can see that 2.9% of adolescents had bipolar disorder, but 2.6 of that statistic had a severe impairment, right? And bipolar disorder in adolescents, females, had the higher prevalence than males. Then again, this is talking about adolescents, no longer adults. We still see children and young adults under the age of 18 struggling with bipolar disorder. It's not just an adult thing, it's also for people of young ages, right? So let's dive into how this integrates into public health. Bipolar is very important in public health issue since it's one of the leading causes of disability associated with functional impairments. What are these functional impairments? Right? We keep talking about it. These impairments are substance abuse within alcohol or drugs. If you are not treated properly, or let's say sooner than you should have, you might turn into alcohol or drugs because you don't know what's wrong, right? You also may be abused by others, whether that be through social media or whether that be peers, whether that be family, for your manic mood swings, and they don't know that you have this disorder. It could be very, very extensive, right? And this leads to also social anxiety, correct? With social support systems not being there for you, and also having the anxiety to even go out of your house. Once these manic episodes come out, with depression and everything, it can also lead to drastic weight gain or loss, right? With these episodes happening out of nowhere, you might not have the ability to think about eating. Or if you're also having a depression mood swing, you may sort into eating a lot and might gain drastic weight, right? 2.3 million Americans have been diagnosed with this disorder, and the number affected by this disorder is even greater, according to the National Alliance of Mental Illness. As we said, 2 to 4% isn't a lot. It doesn't sound a lot, but once you account the whole United States population, 2.3 million, now that's a lot, right? That's a huge number. And of that 2.3 million with the bipolar disorder, 40% of them that were left untreated went to alcohol, went to drugs as the quote-unquote leading solution, when it shouldn't be, right? You should be supporting, you should find social support, and you should also find treatments, but they don't know because they are not diagnosed yet, right? And within that 40% and the 2.3 million, 25 to 50% of those people with bipolar disorder were left untreated and attempted suicide at least once. 2.3 million, half of that, around 1.15, have attempted suicide, which is the highest rate of any psychiatric disorder. This is why in public health it needs to be treated, right? So how can we prevent that, right? How can we help them? So public health can help by early intervention and preventive strategies, right? We can talk about to get diagnosed, to go to the doctor, to seek for help. And we can also use all the epidemiology statistics to compute databases and staging models to figure out how we can treat people with bipolar disorder. We can also advertise and communicate to those who think they have it, or also to those that do have it, and provide them specific therapies, specific groups that will help, maybe even groups of other people who have bipolar disorder that can talk about how they feel and know that they're not alone. So we already dived into it a little bit, but let's talk about the prevention, right? So starting off with 3 solutions, we can do psychiatric assessments, which is the assessment, talk about your feelings and patterns within your life. Mood charting, daily records of your moods. So within a scale of 1 to 10, how are you feeling? All that. And to make sure that you fit into the criteria of bipolar related disorders using DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders. This is to realize if you do have bipolar disorder, or if you have another disorder that could be mental as well, right? Treatments that start with, of course, medications, right? The medications will be described later on, but these medications will help you with your manic episodes and balance your moods to make sure that you don't have elevated mood swings, high energy out of nowhere, to make sure that everything stays balanced. And the day treatment programs they can provide can provide counseling to make sure that your moods are steady and you have something to talk about, correct? And the hospitalization, let's say that medication isn't enough and that you are already dangerously severe from bipolar disorder, right? With the heavy suicidal thoughts, you can go to the hospital and seek help there with psychiatric treatment, right? There's always a solution. With the medications that we were just talking about, there are mood stabilizers, which makes sure that all your moods are steady, making sure that you're not over drastically energetic and then under drastically with low energy, right? Antipsychotics to make sure that the thoughts of suicide, the thoughts of anything that is beyond regular will be treated. It'll be lowered down with the moods, right? We don't want anyone to commit suicide, correct? Antidepressants to prevent any of those depressive mood swings, and the anti-anxiety medications. This will help good with social anxiety or just confronting or going out with your emotions when you in a social place, right? Whether that be the therapy groups that you're in or just talking to someone outside of your house, right? And although that medications sound easy, finding the right medication is actually very important. It will take some trial and error to find out which medication goes right with you when you have bipolar disorder. Because if you continue on with the wrong medication, it can cause a lot more manic episodes and cause even more stress on the person, right? Because if you are continuing to take the medication and you don't seek any sort of equal emotions, you're going to continue having those manic episodes. So it's trial and error when you're trying to find the right medication, right? And the programs and therapy that you can get, cognitive behavioral therapy, to make sure that you are knowing what's good and what's bad for behavior and what should be accepted, right? Psychoeducation, which is educating yourself about your bipolar disorder and knowing what's right and wrong, and also knowing the facts and statistics of bipolar disorder. Family focused therapy, where your family is there for you and also there for support to make sure that you know that you're not alone. And social rhythm therapy, which is going to help you understand that you don't need anxiety when you're in society and when you're talking to people. It just helps with their social practices, correct? And if bipolar disorder was just left untreated and substance abuse has already begun, it doesn't mean that you cannot recover, because you can also do sober recovery programs and group therapy to talk about your addiction, as well as opening up and saying that you do have bipolar disorder, and that will help a lot, right? So I just want to say thank you for watching, and this is my references. Thank you.